And I'd like to welcome you all to our Thursday 1:30 p.m. session where Margaret will be taking us and learning us on diabetes complications and the importance of monitoring and self-care. I'm going to read our disclaimer before we get started. The WildTech DC Senior iPad program, its owners and presenters offer technical assistance, virtual health well-being information designed for educational purposes only. You should not rely on the information, any applications, or topics made by WildTech, including but not limited to mobile device applications and any social media pages maintained by WildTech, its owners, or presenters as a substitute for professional medical advice, diagnosis, treatment, or legal advice. Thank you so much for letting me read the disclaimer. If you cannot see us, hear us, or see the screen, please let us know in the chat. We would appreciate that. I always recommend that you have some kind of notes next to you so you can record them for later on and be able to review them. And as always, let's make sure our TVs and cell phones are silenced so that way we can give others, and most importantly, ourselves, the most immersive experience. Again, Margaret, if you could introduce yourself and your topic for today, we would really appreciate it. And again, thank you so much for presenting to our seniors.
Thank you. Okay, I'll go ahead and share my screen now. Hello, everyone. Please let me know if you can see my screen.
Yeah, you're good to go. I would move the Zoom box to the right so you can minimize it.
Okay.
Mm-hmm.
So good.
There it is.
All right. Good afternoon, everyone. My name is Margaret. Today, I'll be talking about the complications of diabetes and the importance of monitoring and self-care. This is going to be a continuation of our Tuesday section where we did diabetes 101. We looked, okay, for for our new seniors, I'm a pharmacist. So this is me. I'm a pharmacist with over 6 years of experience. I'm the founder of the Diabetes Care Network. The Diabetes Care Network is an organization in Nigeria where we teach people who have type 2 diabetes on proven strategies that helps them manage the disease in a way that leads to the reversal of the disease. The essence of educating people with diabetes is to ensure that they have the right knowledge so they don't over rely on their medications. This is because in Nigeria, 90% of the population pay out of pocket for their healthcare needs, and it's very, very expensive for those who do not have good jobs. So we thought it wise to train people, teach people on how to use simple lifestyle changes in managing the disease better so they don't have to spend so much on medications. So far, I've been able to successfully help my mom manage the disease, and it was because of my mom I went on to organize or pioneer this network. I'm also a Mandela Washington Fellow, which is a program sponsored by the US Department of State, and that is how I got to volunteer here with White Tech. Now, recap from our last Tuesday section, we looked at what diabetes was. We said that diabetes is a chronic disease that interferes with how the body utilizes energy or food to produce energy. And we looked at insulin, which we said was a very important hormone that helps move sugar or excess sugar in the bloodstream to the various cells that needs them. We also established that if insulin is not present in the blood or if it's not functioning optimally, it's going to result to high levels of glucose in our bloodstream. And we also established last Tuesday that the human body functions in a state of balance. So for every parameter, be it your blood pressure, we don't want it to be too high, and we don't want it to be too low. We want it to be within the normal range. The same holds true for our sugar levels. We don't want your sugar level to be too high. I don't want it to be too low. We want it to be within the normal range. We also looked at the types of diabetes. We mentioned type 1 diabetes, type 2, and gestational diabetes. We also looked at pre-diabetes, where we said that if caught early, pre-diabetes can be reversed so it does not progress to type 2 diabetes. We looked at the signs and symptoms of diabetes, where we mentioned the 3 classical signs of diabetes being frequent urination, excessive thirst, and excessive hunger. Then we watched a very short video that showed us how to understand or read the various readings of our blood glucose levels, so we know when it's normal and when it's not normal, right? For the various tests, the fasting blood sugar test, the 2 hours glucose test, and the A1C test. Then we delved into superfoods for diabetes, where we said that the less processed a food is, the healthier it is. So the more processed it is, the less nutritious that food is. So we are encouraged to eat more fresh, green leafy vegetables and less of the processed foods. Then we looked at the exercises for diabetics, where we said that it is important to exercise based on our individual capabilities. However, consistency is key if we want to get the benefits of exercising. It's important that we exercise at least 30 minutes a day and for at least 5 days a week. So consistency is key if we want to reap the benefits of exercising, right? Okay, so today, before we proceed, I'll be showing us a testimonial video from participants of the Diabetes Care Network. Now, why is this video important? In the course of this presentation, we'll be looking at the complications of diabetes, and you get to understand that indeed diabetes is a big deal. If left unchecked, if not properly addressed, diabetes can cause lots of disruptions to the various organs of our body. Now, in Nigeria, when we help people reverse their disease or understand how to bring the sugar level down to the normal range, the testimonials are usually mind-blowing. So I'll be sharing some of these testimonials with us. So we just watch and listen. Thank you. Okay.
Years ago, my mom was diagnosed with diabetes, and I found the Diabetes Care Network on Facebook, and I reached out to her founder, Margaret, and sincerely, she was God sent. She helped me through it, gave me meal plans, talked to me through it. She provided what psychological, physical, mental support for me throughout that period, and she taught me ways to help my mom get through the process and obtain remission. And yeah, it's been more than a year. She's been off drugs and she's been able to keep her sugar level in control. I'm so grateful, Margaret, and I really wish you're able to do this for more people, to help many houses, because I know diabetes is one of the challenges we go through, especially in this part of the world.
My thanks go to my daughter, Margaret. Since I came in contact with her, my sugar level has dropped. I used to have 250, 260, 300, 350. And they will say, this sugar level is not fine, or we may go to Kumau. But since I came in contact with her through my daughter, Regina, who met her online, she gave me a timetable of eating, which I follow, eating fruits, vegetables strictly. And now I'm happy. I can have even 96, 100, 120, 120. 1:08 or 1:30. So I'm very happy with her. May God be with her. May she continue to help us as she has been doing.
My mom's sugar level used to shoot above 200 and something when I met Maggie through a referral link shared by my friend. Ever since then, I've been following her pages on WhatsApp and Facebook, and I must say she's doing a great job. I chatted her, I bought her book, which is Management of Type 2 Diabetes and E2B Sugar. After coaching me on intermittent fasting, lifestyle moderation, and meal plan of less refined carbohydrates, moderate protein, and more dietary fats and vegetables, I was able to achieve a normal weight level for my mom. It wasn't easy, I must say, but now it's a lifestyle for her, and she doesn't need to go to take so much medication. She manages herself using her glucometer at home and eats the right thing at the right time. So a big kudos to Maggie and her team.
Okay, thank you for watching. Any comments on the video? Any thoughts so far before we proceed to today's presentation?
Thank you so much for showcasing that video, Margaret. If you all would like to comment or have a question for Margaret, please raise your hand. You can either raise hand by hitting more at the top right, and then you can tap raise hand, or at the bottom, you can, if your toolbar is at the bottom, you can hit reactions and then tap on raise hand. So again, if you would like to share a comment or a question for Margaret about that video, please raise your hand in Zoom, and we'd love to hear from you. First up is Anne, but again, if you would like to share a comment, please raise your hand in Zoom. Hey, Anne, how are you?
I'm doing well, thank you, Alex. Margaret, I just wanted to say that looks like that you have been successful with that program, and maybe from this you will give those of us who are suffering with some more hints to deal with what we've been dealing with for years. Because I personally am tired of medicine, looking for another way out. So thank you.
Okay, thank you so much, Miss Anne.
And congratulations on being successful with your program.
Thank you very much. From last week's conversation, we realized that one of us here has also been able to successfully reverse type 2 diabetes. So it's a program that is common everywhere, even here in the States especially. You just need to talk to your primary care physician and your nutritionist, and they'll be able to work a plan for you so that gradually you can reduce your dependence on medications. You just need to communicate your goals with your primary care physician.
Thank you so much, Anne, and thank you, Margaret. Again, any other questions or comments, please raise your hand in Zoom about the video. We have one more so far. Ms. Vernell, thanks so much for joining. You have a question or comment for Margaret? You have to hit unmute in the middle. Ms. Vernell, you got to hit unmute in the middle if you want to unmute yourself. And I sent you a prompt in the middle, Ms. Vernell. If you're in Zoom, you just have to hit unmute in the middle if you want to unmute yourself. There you go. You have a question or comment for Margaret?
Yes, I do. I was using Epsom salt to soak my feet, but the doctor told, not the doctor, a neighbor told me that I shouldn't be using Epsom salt. So I haven't been back to the doctor to ask her. Can you enlighten me on that?
Oh, thank you so much. Well, it's very important that we get medical advice from our primary care physicians. This is because different people react differently to the same product. And your primary care physician has your history, has your charts, knows your allergies, etc. So taking advice from people, from neighbors who don't have the required expertise is not encouraged. I would strongly recommend you visit your primary care physician so you understand why you want to use Epsom salts to soak your feet, and also based on your history, based on your unique medication history, your primary care physician will be able to advise you appropriately. So I strongly recommend you go see your primary care physician and communicate this challenge with him or her.
Okay, thank you so much.
You're welcome.
Thank you, Ms. Furnell. Appreciate it. Don't forget to lower your hand and mute yourself. Thank you so much. And our last question or comment for now is from Miss Maria. And thanks so much for joining.
Thank you. Good afternoon.
Yes.
Yes, with the diabetes, I have diabetes. I've had it a long time now, but no matter how hard you try to manage it, it still may be too high or too low, even if you eat right. So why is that?
Okay, so that's a very, very, very important and very good question. Thank you so much. And in my years of experience working with type 2 diabetics, it's been a major challenge because if you take too much medications, it brings down your sugar level. And in today's presentation, we'll be looking at hypoglycemia, which is not ideal. There is actually a way you can manage the disease successfully, and that's through continuous glucose monitoring. I would explain that in this presentation. Now, when you start taking medications, when you eat any food, it is recommended that you check your sugar level and note it. So if you take any drug, you take any medication, you check your sugar level 2 hours after and you note it down. If it causes a spike or a dip in your sugar level, it gives you an idea of what to do next. So if that particular food or medication or activity led to a spike in your sugar level, you note it down so that when next you go visit your primary care physician or your diabetes care team, though it will be very easy for them to pinpoint the activities, the foods, the drugs that are not specifically good for you. Like I said, different people react differently to the same product. It is when we eat and check, when we monitor consistently, that we are able to determine what works for us as individuals. So as against just taking your drugs and eating and not checking how they affect your sugar level, it is recommended that as you eat, as you take your drugs, you monitor consistently and you document. That way you're able to track what causes a spike in your sugar level and what causes a dip. If this medication makes your sugar level go too low, you have information to present to your primary care physician, who would, with his expert knowledge, temper on the dose of the medication. So it's all about consistent monitoring of your blood sugar level and documenting it. That is the game changer in effectively managing that 2 diabetes, because different people react differently to the same substance. I hope that helps.
Well, I haven't eaten anything since breakfast, but after that, I ate an orange and I ate a pear, and I take my insulin again around 2:00, 2:30. So I test myself just now, and my sugar is 153.
Okay.
So is that because I haven't eaten anything in between breakfast? All I ate was some fruit after breakfast.
153 as random is within the safe range. But do you document your sugar readings?
What did I eat for breakfast?
No, do you document your readings? So when you check, do you write it down somewhere?
Well, before breakfast, I was 96.
Okay,
After
so
breakfast, around about 12, I was 128. And about an hour ago, I ate the orange and the pear, and now 153.
Okay, so what I recommend is you take note of all of this. So when next you visit your physician, you'll be able to show how these various activities affect your sugar level, and you'll be able to recommend what to do professionally for you.
Well, my nurse was here on Monday, and everything was fine. My blood pressure was 123, and my matter of fact, my A1C is 6.7.
That's good. So for diabetes, it's actually a process. It's not an event. So over a period of time, the body gets to adjust. And as you imbibe positive lifestyle changes, over a period of time, you get to see consistent results. So that is why it's important that you track and then communicate with your primary care physician.
Okay.
Yeah.
All right, then. Thank you.
You're welcome. You're doing very well. Good job.
Okay.
Thank you, Miss Maria. Appreciate it. Yep. So, yep. Thank you all so much for your comments and questions, you all. Again, please don't forget to lower your hand and mute yourselves after your questions. But thank you so much for those. Let's go on, Margaret.
All right. Thank you, Alex. Okay, so in today's presentation, we'll be looking at the complications of diabetes. We'll also look at how to prevent the complications of diabetes. And that will take us to blood glucose monitoring and documentation, like I've been saying for the past 2 minutes. We'll look at food care, dental care, vision or eye care, then emotional and mental health. Now, diabetes is one disease that affects almost every part of the body. Like, if diabetes is not properly managed, it can cause damage to any organ in your body that you can think of. So from the eyes, diabetes is the leading cause of blindness worldwide now, and it can cause retinopathy. Diabetes can lead to heart attack. Diabetes can cause peripheral neuropathy, that it can damage your nerves so that you don't have any sensation, or you start feeling burning sensations around your hands or your feet. Diabetes can lead to diabetic foot infections. On Tuesday, we talked about non-healing wounds as a symptom of diabetes. Now, if that progresses because blood flow cannot get to the wound sites and facilitate healing, it can lead to gangrene that can precipitate amputations. Diabetes can also lead to chronic kidney disease. Yes, because remember on Tuesday, we talked about excessive urination, where the kidney is trying to remove the excess glucose from the body. Now, if that is left to continue over a period of time, the kidneys would get overworked and they could just shut down. Diabetes can also cause brain disease. Now, imagine that your brain cells especially, that are always working, require energy to function, right? And if insulin, due to diabetes, is not functioning optimally, if the cells in your brain cannot access the glucose in your blood because they are not responsive to the action of insulin, it then means that the brain cells will be starved of the energy they need to function, which can lead to stroke and other brain diseases. So diabetes is one disease that affects almost every part of the body, which is why it is important that we learn how to effectively manage the disease and educate others on the importance of checking their sugar levels consistently so that they are able to track and manage the disease effectively. Okay. Now, majorly the complications of diabetes are divided into two the microvascular complications, and the macrovascular complications. So the macrovascular complications are complications that affect the large muscles of the body, like organs that are supplied by the large blood vessels. Then the macrovascular complications are complications that affect organs that are supplied by the smaller blood vessels. So in terms of macrovascular complications, we have the brain. The brain is supplied by a large blood vessel. And as I mentioned, diabetes can lead to an increased risk of stroke and cerebrovascular disease, because if the brain cells are starved of the glucose they need to function, they are going to shut down, and we don't want that to happen. Diabetes can also affect your heart, and it can lead to coronary artery disease. Now, lower extremities, because the glucose in the blood is so much, it makes the blood viscous, such that blood flow to the lower extremities, to your feet, to your hands, is reduced, and this can lead to injuries not healing very fast. It can also lead to you not having any form of sensation. It can also lead to gangrene. So when injuries are left unattended to, when the normal wound healing process in the body is no longer functioning, bacteria are going to feed on that wound. And if not treated, it can lead to gangrene, where the doctor would have to cut it off. All right, so on the microvascular side, we have the eyes, where high blood sugar levels can cause damage to your retina, leading to retinopathy. It can lead to blindness. To your kidneys, like I also mentioned, that excess blood glucose overworks the kidneys, and it can result in nephropathy, right? Then there's something called neuropathy. This is very important because high blood sugar level can cause damage to your nerve cells. When that happens, it means you no longer feel sensation around that damaged region. So if the nerves around your feet are damaged, if you step on a sharp object, usually the normal reaction is to scream because of the pain, right? But when the nerves in that region are damaged, even if you step on a very sharp object, you would not know. You will not feel the pain. This is where we say pain is a good response. But when you're not able to feel that pain, it means the brain is not aware that something wrong is going on, and you just keep moving as though nothing happens. What it means is, because you've stepped your feet on that sharp object, you've injured your feet, but you're not aware. You cannot feel the pain because the nerves around that region have been damaged. This is what makes them, because you don't know that you've actually incurred an injury there, you would not treat it, you would not go visit your doctor, and by the time you notice, it's rather too late. So it is very important that we do everything in our power to ensure that our blood sugar levels are always within the normal range, because the complications can just form a very vicious cycle. Now, how do we prevent these complications? So I'm not here to scare you, I'm not here to scare you about the complications of diabetes. My aim is to empower you, or to reassure you that although diabetes has these awful complications, if managed properly, you can reverse it and live your life in super health, okay? You can also manage it effectively, and you would not stand the risk of these complications. Now, how do you prevent the complications of diabetes? Number one, monitor your sugar levels frequently as recommended by your healthcare provider. You know, on Tuesday, we mentioned that proper management of diabetes involves a multidisciplinary approach, where you have your doctor, you have your nurses, you have your dietitian, You have your physiotherapist as well. So you talk to your team and they're able to tell you how often you should check your sugar level. So for someone taking insulin, it is required that you check your sugar level more often than another person who is on just oral medication. So you need to communicate and work with your healthcare team, okay? But it is important that you check your sugar levels. If you don't check your sugar level, you will not know that your sugar is high or low. And if you don't know, you'll not be able to act on it. So you need that information to act properly. So I encourage everyone, if you have elderly siblings, encourage them to check their sugar level. If you don't check, you will not know. And it's one thing to check, it's another to document. So most times we just check and stop documenting. It is important to check and write it down. When you write, if you do this for a week or 2 weeks, you're going to see patterns in the numbers, and that information would help your doctor better provide quality care for you. So monitor, check your sugar level and document it. So you can have a tracker that you can just download and print or write down your numbers. So when next you go to your doctor or you have an appointment, your doctor can go through the chart and be able to advise you better. That's number 2. Then number 3 is adhere to your medications. Now, why it is important that we imbibe healthy lifestyle changes? It's a process, like I said. It's not an event that just happens immediately. Diabetes is not an infection where you take antibiotics and after 7 days, the bacteria is out, you're good. No, it's a process. So you need to stick to your medication regimen as prescribed by your doctor. If you notice any form of side effects or if you start feeling in a way that you're not comfortable, you communicate immediately to your doctor so that they can review your medication dose. If you're on medication for a long time and you check that due to proper monitoring and documentation, you can tell if that medication is good for you. If it's not good for you, with the readings you have documented down, you can take it to your doctor and you'll be able to recommend or prescribe another molecule that would work well for you. So it's in managing type 2 diabetes, we all have to be involved. It's not something we leave for just our doctors. We have to be intentional about helping our doctors make the right decisions for us based on the numbers we have. Then we have what we call continuous glucose monitoring. This is a device that's very common for people with type 1 diabetes. And it's also common here in the US where you can know your sugar level in real time. So it's a simple device you just attach and you're able to see your sugar level in real time. Now, signs of hypoglycemia. This is a complication of diabetes because most times people just take drugs and they don't monitor their sugar level. They take insulin and they don't monitor the sugar level to see if it has gone below the normal range. Now, when your sugar level is below the normal range, it is as dangerous as when your sugar level is above the normal range. Again, like I said, the body functions in a state of balance. So here are some signs that would tell you if your sugar level is too low. And in the next slides, I will tell you what to do if you notice any of these signs, okay? For example, myself, I have a very fast metabolism. And if I don't eat early enough, I come down with most of these signs. And I know that I need to grab something to eat. And that's me. Imagine someone who is taking insulin or a drug that leads to low sugar level and you don't monitor or you ignore any of these signs, it can become very dangerous. So it's important we take note of these signs and act appropriately. So signs of hypoglycemia, number 1, shakiness or trembling. When you feel that your hands, your feet are becoming very shaky, you'd want to check your sugar level, right? Profuse sweating. When you start sweating uncontrollably and it's unusual, if the weather is not hot, but you're sweating and you're shaking, please check your sugar level. If you're hungry and you start having headaches, it's important to check your sugar level. If you start feeling dizzy or lightheaded, please check your sugar level. If you're very weak or you get easily irritable, please check your sugar level. Now, something happened last time. I made a post about the signs of hypoglycemia on Facebook, and someone left a comment on that post. He said that he didn't know about this sign. If he had known about it, probably he wouldn't have lost his mom. So what happened was the mom was on insulin and she did not eat any food. She went out and did not eat till about 2 p.m. She had not eaten anything and she had taken insulin and she started having these signs. So instead of them to quickly check and give her something to eat, she just slumped and hit her head, and that was it. So it's very important that when we are on medications, we should check our sugar level and eat appropriately. That is why you need to communicate with your healthcare team so you properly understand what to do and at what time, right? Now, if you notice any of these symptoms, if you and you know you've not, if you notice any of these symptoms, these are the 3 things you should do. It's called the 3 C's. The first C is check, the second C is consume, the third C is check. Now, you check your sugar level to confirm that it is less than 60 milligram per DL. So if it is less than 60 milligram per DL, what do? You consume, you eat a fast absorbing carb-rich food. So most times people who are on insulin are encouraged to have glucose snack, glucose bar around them, or a quick Coke, something that is rich in glucose. So once you start feeling any of these signs of hypoglycemia, you quickly take that fruit juice, that glucose tablet, that candy bar to bring your sugar level back to the normal range. And once you've done that, 15 minutes after, please check again to be sure that your sugar level is now within the normal range. So it's very easy. If you notice any of these signs, shakiness, profuse sweating, hunger, headaches, dizziness, lightheadedness, you're feeling very weak, you're becoming very irritable, please check your sugar level. When you've checked that it is low, get something that's, if gets a fast acting carb-rich food like a glucose bar, a fruit juice, or candy bars. When you've eaten them, 15 minutes after, check that the sugar level is within the normal range. If it is not within the normal range, eat, consume more, and check again until your sugar level is stabilized. Any questions so far, or I should just continue?
Again, thank you so much for the information, Margaret. Really appreciate that. So again, you've talked about the 3 C's, some symptoms of hypoglycemia, different things regarding complications of diabetes. Thank you so much. Any questions or comments about anything so far before Margaret goes into the different parts of your body that you need to care for when living with diabetes? Any questions or comments? Anything covered so far? Okay, Anne, any questions or comment?
I'm sorry to keep asking questions, but can your blood pressure also cause some of the dizziness if it goes too high or too low? Because my sugar was okay, but my pressure was up and I was dizzy. So that was the first time, but I had been upset about something and my pressure went up real high and I didn't realize that, and I had not eaten. So can your blood pressure cause the dizziness too?
Yes, definitely it can.
Okay. Thank you, Margaret.
You're welcome.
This is so informative. I tell you, we need to have this again.
Thank you. I'm glad that you're enjoying everything so far. It is very important. So
it is, especially when you've been suffering with it and you thought you were on the right path.
Again, thank you so much, Anne. We really appreciate your participation. Our next hand is from Miss Dolores Hampton. Any question or comment for Margaret?
Yes, I have a question. If someone's sugar goes real low and they don't have like the candy bars or the juice or the glucose pills around, what next can you do to bring it up?
That's
Because
a very yeah, go ahead.
Go ahead.
Okay. What you can do is to drink water, but you can take lots of water, but that you take water, then you call on someone to get you that glucose juice, that candy bear, ask for assistance.
Okay, and then when it get too high and you don't, is it water to bring it down also?
No, so when it gets too high, then you need to check if you're due for your medication, because your insulin has time intervals, your drugs have time intervals. So I'm sure if you've documented for a period of time, you'll be able to tell situations that leads to a spike or a dip in your sugar level. Like Miss Anne said that she was upset and she had not eaten. So because she was upset, her blood pressure soared. She had not eaten. She started having headaches. So over a period of time, we get to know what our triggers are, and we stop those triggers from happening, right? So if your sugar level is high, then you need to confirm with your doctor at what point have you noticed that your sugar level gets high. With that information, your doctor will be able to tweak your medication regimen to fit that schedule.
Okay, I take care of my mom, so she has it, but sometimes, well, she was on metformin, but they took her off. She was on twice a day, but they took her off. But she wears like the monitor where you can just scan it. However, it's no medication. She's not on insulin. She was just taking the metformin. So I was wondering what, like, in the morning, her sugar sometimes is like 284, almost 300. Sometimes after she eats, it's fine. But then like hours later, it's like almost 200, over 200. So, and it's like no medication. So is it something like you said to bring it down, like, because she's not on medication? They took her off it.
Okay, so what you can do is document the sugar levels. Then when next you see your primary care physician, you show him that these are the readings you've been getting for a period of time, and be able to proceed with that information. But I would also want to comment on the sharp spike in sugar levels in the mornings. So there's something called down phenomenon. And it means down phenomenon implies that in the mornings, your sugar level will be higher than normal because you're trying to wake up. So the body is going to increase. It's a physiological phenomenon that happens, so that in the early hours of the morning, your sugar level increases. So what you can do in that regards is to check your sugar level a little bit later. If you experience down phenomenon, instead of checking around 8:30 a.m., you can check around 9:10 a.m. Now we'll be able to get a real picture of what's going on. But if the doctor has removed your mom from the medication, please keep checking the sugar level, write the date and the values and the time. Then when next you go to visit your physician, you can show him or her the readings, and they'll be able to make a decision with those readings. It's also important that you note the kind of foods that spike our sugar level too. That would help your dietitian. So if she takes a particular breakfast cereal or recipe and it leads to a spike in our sugar level, you want to note it down. Because on Tuesday, we spoke about the healthy superfoods for diabetes. So
yes.
you eat any of those, and you would want to note how she reacts to those foods and note it, and it will be able to inform your healthcare team on how to proceed.
Thank you so much.
You're welcome.
Thank you, Ms. Dolores. Have a great rest of your day. Thank you. Appreciate it. I think just in the interest of time, we're almost out of time, you all. We're gonna save the questions until the end. I see yours in the chat, Dolores, so we'll keep that there. And then Ms. Vernell, please keep your hand up. We'd really appreciate that. But Margaret, you can go ahead and continue on with the other parts of the body we should take note of if we have diabetes or just in general.
All right, thank you so much, Alex. In the next few slides, we'll be looking at how to take care of those parts of the body we mentioned are prone to complications, right? So I talked about diabetic foot ulcer, which is a leading cause of amputation. So here are some tips from the CDC that we can, or some steps we can practice to prevent our risk of coming down with diabetic foot ulcer. So number one, check your feet every day. Why is this important? Excuse me. Thank you. So why is it important to check our feet? Remember I mentioned that diabetes could cause neuropathy, such that even if you have an injury, you would not know because the pain sensation is not being sent to the brain. But when you use a mirror to check your feet, you'll be able to tell if there's an injury or if there's an abnormal growth around your feet. Remember, in medicine, early detection is key. So if you're able to detect it early enough, your doctors will be able to manage it better. So the first step is check your feet every day. Check for cuts, check for redness, check for swelling, for sores, for blisters, for corns, for calluses. Just check. Make sure you check your feet every day using a hand mirror. Number two, wash your feet every day in warm water, not hot water. Warm water and dry them well. Water is enough, right? Then never go barefooted, even inside the house. We recommend that you wear socks, like always wear socks so they can protect your feet. So they can protect your feet. So always put on socks when you're in the house, and wear shoes that fit well. Don't wear shoes that are too tight, because if you wear shoes that are too tight and there is a blister around your toes, it increases your risk of coming down with injuries. And with diabetes, you know that injuries would not heal as fast as they would. So you want to prevent all of those from happening. So please wear comfortable shoes, shoes that fit very well. They are loose and they are not tight. Then trim your toenails straight across. Like, don't try to bend it so you don't injure yourself. So trim your toenails straight across and smooth out sharp edges with a nail file. But you have to be very careful when doing this. Also, don't try to remove corns or calluses yourself. Get help. Okay, so in someone who doesn't have diabetes, you would want to apply some form of self-care when you have any injury around your feet. But if you're diabetic, it is important. It is very, very important that you talk to your primary care physician immediately so they can manage it appropriately. Okay, so get your feet checked at every healthcare visit and visit your foot doctor at least once a year. I'm sure if we do all of this, we are going to greatly minimize our risk of having diabetic foot ulcer, because we'll be able to catch any injury sores as they come early enough and they'll be treated. Okay. Next is dental care. Now you'll be wondering what concerns diabetes with our tooth. Diabetes is one disease that affects every part of our body. Now, if there's a gum infection, it increases your sugar level through what we call inflammation. So it is And it's often said that if you have diabetes, you are up to 3 times more likely to develop gum disease. And gum disease can further lead to high blood sugar, which can lead to complications, and it makes it difficult for your body to fight infections. So this is a very vicious cycle. We need to ensure that we floss and we brush our teeth twice a day, especially at night before we sleep. And it's important that we also check our gum for any form of injury or abnormality so we can quickly report to our primary care physician. Okay, then we are looking at vision care. We mentioned that diabetes can lead to retinopathy. It can affect the retina and can lead to blindness. So what do you do to prevent or minimize your risk of having retinopathy? Number one, have a dilated eye exam every year. Then you follow these steps called track. Take your medications as prescribed by your doctor. I had already mentioned that. Reach and maintain a healthy weight. We spoke about this during our Diabetes 101 section on Tuesday. Add more physical activity to your daily routine. We talked about exercises and how it benefits diabetics. Then control your ABCs. That's your A1C, your blood pressure, and your cholesterol level. Remember on Tuesday, I also mentioned that people with type 2 diabetes also have high risk of high cholesterol level. So it's important that you control your A1C, your blood pressure, and your cholesterol level. Then kick the smoking habits. Yes, smoking is a risk factor for so many chronic diseases. So if you want to retain your vision or maintain proper eye care, please take your medications as prescribed by your doctor, maintain a healthy weight, add more physical activity to your daily routine. Like I said, 30 minutes of a self-paced physical activity every day for at least 5 days a week will go a long way in helping you achieve your health goals. Then control your A1C, your blood pressure, and your cholesterol levels. Then kick the smoking habits. Now, emotional and mental support. With all of these, with everything we've said so far, it goes without saying that people with diabetes undergo a form of emotional distress. From my mom and the other clients I've worked with, it's not really an easy journey, but when they're able to achieve their health goals, they're very happy. So the process between where you're feeling very bad and depressed with this disease to when you achieve your health goals, how do we support you, or how do you support people going through this journey? Stats have shown that 3 in 5 people living with diabetes experience emotional or mental health problems as a result of the condition. Even the caregivers, like children of diabetics, also go through emotional stress. Most of the people I work directly are with are children of diabetics, and I know how concerned and worried they are about the health of their parents. So it's important that we show empathy to everyone, especially to people who are dealing with chronic diseases like diabetes. So what's the way forward? Number one is open communication. It is okay to not be okay. I think our last session, last week, we had Doris come talk about emotional well-being and mental health. And I loved when she said that mental health is not the norm in seniors. This is because mental health issues affect everybody. During our institute in UMBC, we had a section on mental health because it affects both the young and the old, and it's not normal for anybody to come to see. It's not normal to see it as normal. But one thing we can do is communicate about it. It is okay to not be okay, right? So when you accept that you're not okay, you open yourself up to receive help that is available to you. So number one, you have to communicate openly. How do you feel about this disease? How do you feel it's impacting on your mental health? Talk to a professional and they'll be able to walk you through it. Number 2, balanced lifestyle. Take a walk, eat a balanced meal, get enough sleep, and understand that managing diabetes is not a sprint, it's a marathon. It takes consistent efforts to get that result. But the fact that there are people who have gotten that result should inspire you to keep on moving, right? So do what you love. Take a walk, be physically active, be involved in a community, be involved in your church program. I love what White Tech is doing, creating a platform where seniors can come, talk, and share about their life experiences. This alone is a lot of therapy, and having a support group goes a long way in helping you manage not just medical illnesses, but emotional ones as well. So it's important that you have a support group. For the Diabetes Care Network, we have a support group where we talk and encourage ourselves once in a while. And if anybody has a question, they can ask and they get that support. So meet people, talk to people, do the things that make you happy. Just have a balanced lifestyle. And lastly, practice self-love. This is one thing I do. If I'm in a new environment and I don't know how to navigate the area, I love myself and I do what is comfortable for me, right? Irrespective of what any other person thinks or says. So love yourself, practice self-love. I have this favorite quote from my favorite poem. It's the Desiderata. It says, "You're a child of the universe, no less than the trees and the stars. You have a right to be here." So whether you're struggling with diabetes, whether you're struggling with any form of condition, any challenge you have a right to be here. You're a child of the universe. So you're not going to allow those situations, those diseases define you. No, you're going to define them for yourself. So I hope that with these few points, you're able to gain courage, ask the right questions, accept the right support, and also offer the support to people around us. So we need to learn to communicate openly with empathy, practice a balanced lifestyle, and love ourselves. Like, nobody can love you more than you love yourself. Love yourself. If you love yourself, you're going to eat right. If you love yourself, you will sleep well. If you love yourself, you do the things that make you happy. And with that, we've come to the end of this presentation. Thank you all so very much.
Thank you so much, Margaret. I love that that last slide with just things that you can do to help you mentally, because again, that also affects a lot of your physical self and your mental self and everything. So I love how you touched on the different things that diabetes may affect, and it's many different parts of your body. So it's so important just to recognize how you are, how you're feeling, and like you said, to ask for help. You know, we're in DC, there are so many different resources and folks available that in different topics. So once you know to ask for help, that's the first step. So that way, then you can receive it. So I really love that. And thank you so much for sharing. I really appreciate that, Margaret. Do you all have any do you all have any questions or comments or anything that you would like to share from Margaret? Any last thoughts for today? Please raise your hand in Zoom. We'd love to hear from you about, again, any comments for today, any questions, etc. before we end, but let's make sure to stay on the Zoom to complete a poll to let us know how you felt about today's session. Our first question was from earlier. The question was, even if you are not a diabetic, but want to test your blood sugar level at home, where would you get the equipment? Are you able to answer that, Margaret?
Well, thank you for that question. Here in the US, I'm not sure about the processes, but this is something you can talk to your primary care physician. But in Nigeria, glucometers are over the counter. So you just go to the pharmacy and you're able to, they'll train you on how to get the glucometer and how to use it. But here in the US, I'm not sure. So you might want to consult with your primary care physician, and it's something that they would encourage you to get at home, so you get to check your sugar level, whether or not you're diabetic, so you're able to catch it early. But please talk to your pharmacist. Yeah, you can talk to your pharmacist or get clarification from your primary health care physician.
Thank you so much for answering that, Margaret. I hope that helped out, Ms. Dolores. Thank you so much. Our next question or comment, again, please raise your hand if you would like to share any comments or questions for Margaret's session. Hi, Ms. Laverne. Hope you enjoyed today. You have a question or comment for Margaret?
Hello, Alex. Miss Margaret, I'd like to say thank you so very much. Everything was so informative, and I'm a diabetic, and you helped me remember and touch on things that I need to do as far as the dialogue and my sugars when I take my sugars, so I can make sure that I keep track of them, because I do forget at times. But I appreciate everything and truly thank you so much.
You're welcome. My pleasure. Thank you too.
Thank you, Ms. Laverne. We really appreciate you sharing. Our next hand is from Ms. Dina. Thanks so much for joining us today. You have a question or comment from Margaret?
Yes, I have a comment. Thank you, Miss Margaret. I have been to UDC, University of DC, for nursing assistant, but also I am a type 2 diabetic on insulin and metformin, the pill. But I like to add to addition, you know, you have to be experienced about different diseases. And I, excuse me, I like to say about to add on about the feet. A lot of people who are diabetics go to these manicurists or, you know, pedicurists, whatever you call them, to do their nails, and they like to have their feet done, who are diabetics, which really, you're diabetic, you need to leave your feet alone. There are many foot deodorant sprays and powders and everything. You need to get your best advice from your physician, because every individual is different. But you need to leave all that extra stuff alone, because if you have neuropathy, with that numbness in your legs or the slowness, illness in your body, period. And I have seen patients come in with nails stuck in their foot, and they didn't even realize it was in there because of neuropathy. You know, well, if it get infected, there's gangrene. Then the next thing, there's the amputation of the foot or the leg, or however far that stuff goes up, you know. So that's all I could comment a lot about it, but that's basically, I want people to know, don't let your neighbor say, soak your feet in Epsom salt, this, that. Ask your doctor what's best for you before you end up with a problem, if your feet are okay. That's all I gotta say for now.
Thank you so much. Thank you for your comment. And it's true. Remember we mentioned daily foods check, so if you check your foods regularly every day, you'll be able to notice where there's an abnormality. But it is important that you wash your food at home. Just wash it daily with warm water and a good soap, and you're good. But please get your advice from your primary care physician, because like we've all been saying, people react differently to the same product. So you need to get that information on what to do going forward from your doctor. Yeah. Thank you so much for having.
Thank you, Ms. Dina. Really appreciate that. I see your chat in the chat, Ms. Vernell. Did you have something else to share besides that? A question or comment from Margaret? But I hope that previous question helped answer your question. But Ms. Vernell, you have anything else that you would like to share? You got to hit unmute in the middle, ma'am.
No, she answered my question.
Okay, thank you so much. Don't forget, as always, to lower your hand and to mute yourself as well. Thank you so much, Ms. Furnell.
You're welcome.
Any other questions or comments for today, you all? For Margaret, any other questions or comments, please raise your hand in Zoom. But it's very much appreciated and needs to be talked about more, as someone said. So I really appreciate you sharing all this information, Margaret.
You're welcome.
And don't forget to share with your friends and family as always, you all. Anytime we have a guest or a presenter, make sure you share that info with someone else. You may never know whose life you might help or change just with that information. But thank you so much, Margaret, for presenting to everyone today. We really appreciate that. This is not the last time you're going to hear from Margaret, but this is her last session with us for now. So let's all give a big thank you for Margaret and her presentation today, and make sure you all stay on to complete a poll to let us know how you felt about today's session. Thank you so much, Margaret. Let's all give her a big thank you, and let's wish her a wonderful rest of her day. Thank you so much,
Thank
Margaret.
you,
so much.
Margaret.
Thank you so much,
You
Miss
missed
Margaret.
it.
Okay,
you.
bye.
Thank you.
Proud of you.
Bye.
Thank you
Thank
so
Thank
much.
you
you.
for taking care of
Hey,
your mom and
Margaret.
sharing your information.
Thank you.
Yeah.
Thank
Thank you, Alex.
you.
Thank you.
Good
No
information.
problem.
Tell your phone number.
Thank
Thank you.
you.
Thank you for
Bye.
sharing your information.
Bye.
Bye-bye, darling.
Thank you for
Bye.
taking care of your
Have a
mother.
good day.
God
Yes.
bless
You
God
you.
bless
too.
you for that.
You.
Talk
Bye.
to y'all
Thank
tomorrow.
you.
Yeah. Talk to
Good
y'all
day.
tomorrow.